Hello, everyone. I'm Bethany Saxon. I'm the Director of Communications at the Center for Public Health Law Research at Temple University's Beasley School of Law. Thank you so much for joining us for this first session of the 2021 Legal Epidemiology Satellite Workshop at the 6th Global Law Enforcement and Public Health Conference. We are very sorry we couldn't welcome you to Philadelphia for this event, but we're so pleased to have you joining us today for this session where our panelists will discuss the future of research on the health effects of policing. I'm going to go over just a few housekeeping notes before I hand it over to our moderator, Scott Burris. We have muted all of our participants to try and minimize background noise, so we ask that you keep yourself muted. And we ask you too to keep your video off, so we just have panelists. We'll be recording this session and it will be posted to YouTube and shared on the webpage portal that also houses the other materials for this workshop that you should have already received the link to. I'll include a link in the chat as well, just in case you may have missed that. We'll be hearing from our panelists today and we hope that you'll have questions for them. Questions will be handled in the chat box, which can be found at the bottom of your screen. Hopefully everyone knows where it is at this point in the pandemic and our Zoom our adventure in Zoom. So please feel free to send your questions at any time throughout the discussion and we'll answer them at the end. And before I hand this over to Scott, I do want to make sure that we acknowledge our funders, the National Science Foundation, and thank them for their generous support of this workshop. Scott, go ahead.
Thanks very much, Bethany. Well, a lot of us have been interested in public health for a long time on the health effects of criminal law and law enforcement. From a standpoint in social epidemiology, both fields, I think, find themselves far downstream from the social drivers of population health, having to cope with symptoms of inequality and inequity that should never have been allowed to get so bad. If that sounds depressing, consider today that it is less than a week since President Biden signed a COVID-19 relief package that devotes the better part of $1.9 trillion to the direct benefit of the tens of millions of poor and middle-class Americans who've been left behind by Democratic and Republican policymakers alike since the Reagan administration. Where 4 years ago, Congress spent just about the same amount easing the tax burden of the wealthy, now we're in a moment when the debate about where society should spend its resources may be turning in a healthier direction. Research on the effects of laws and legal practices should be playing a much bigger role in shaping debate and guiding policy. I'm happy that some of the research that we've been involved in and funded through the Public Health Law Research Program, looking at the health effects of minimum wage and tax, earned income tax credits and so on, has been guiding some of the policy debate we've just seen. You know, we devote huge resources to testing medicines before they're even approved for treatment, but we apply legal treatments to tens of millions of people without any real effort to see if they work or have side effects, even years after enactment. With policy looking more dramatically upstream and with greater attention every day to the importance of measuring the health effects of laws and legal practices, our conversation today goes to what research we need when it comes to policing, public health, and building better human security systems in America. I'm joined by four people who have looked at law enforcement and public health from very different but always creative and very humane angles. Tim Akers is the Assistant Vice President for Research, Innovation, and Advocacy and a Professor of Public Health at Morgan State University. He has a long record, both in academia and in CDC, of service to sound policy and social justice. And his work more than a decade ago in epidemiological criminology highlighted the importance of health and health outcomes in criminology. Oscar Alleyne, who's now the Chief of Program and Services of the National Association of City and County Health Officers, NACHO, was also involved in EpiCrim, I find, in our pre-session conversation today, and is now continuing his work at NACHO as one of, I think, the most dynamic, and I hope he won't mind me saying, young public health leaders. Oscar, somebody who a lot of people turn to for advice and inspiration these days. Brandon Del Pozo, who's now a humble postdoc at Brown University, has had a prior career as a police officer, and I think I can say notoriously progressive chief of police, and has now joined us in academia. We round out the panel with Miriam Krinsky, who's the executive director of Fair and Just Prosecution. Miriam and that organization have been amplifiers, instigators, and coordinators of national change in the way prosecution gets done in district attorneys' offices. If you have questions for the panel, and I hope you will, please, as Bethany says, enter them in the chat as we go along. I'll try and work them into the conversation as best I can. But I'm going to start off with a sort of warm-up question for all the members of the panel, with the encouragement that after you start answering, you can feel free to take the tangents of the conversation where they lead. So to each of you, and we can start with Tim, what do you think are the most unimportant, currently unanswered questions about the health effects of policing and criminal justice? Tim?
Well, thanks a lot, Scott, and I appreciate it. And actually, this is serendipitous. If this was a live session, first thing is I state when I open up is, who likes speaking in front of people? Raise your hand. Well, my hand never goes. Who gets nervous? Raise your hand. Okay, so I'll try to accommodate that. But I'm fortunate because I see Brandon on my left and I see Oscar on my right there. Just like Brandon, I've worked in law enforcement on the street as a cop as well, military and all that, focused on counterterrorism. So I appreciate that. But also, and Brandon, I worked in public health at the Centers for Disease Control. So I kind of blend that together. So what you had asked right there, Scott, for me, and working in both law enforcement and public health, I tend to look at it, what myself and our team in epidemiological criminology is one of the main issues that we tend to neglect. It's assumed is the areas of stress and what we call stress discordance. When you look at police officers and all the different aspects that they're working in, stress, and with COVID-19, stress has just been accentuated because now you've got police officers trying to enforce public health law. And so it's added to the dynamic. So stress is a big factor that I would add to that.
Oscar?
Mute. So I think several elements on the engagement of both answering the question and thinking and capacity around the health effects. You know, it has a multi-layered approach, if I can call it that way. There are the health effects with respect to the actual individuals, as Tim kind of mentioned, who are engaged in this practice, and what does that mean, and how does that incorporate their the totality of a response effort. Then there's the health effects with respect to both the communities that are served and the systems that are in place to help address some of these particular matters, and looking at the particular outcomes that come into play. And then there are also the health effects with respect to what does that mean for the future, and the integration of both the as we would call it, implementation science, how things are put into place versus how they're perceived. It's kind of the perceived risk versus actual risk approach. And what does that mean? And what are the implications for the future with respect to our community engagement as a whole? So I'm actually very excited to further participate in this conversation. So I'll pause there because I think there's a lot to discuss.
Brandon?
Hey, thank you. So first, it's looking at the people in the audience. I see so many familiar faces that could easily be here on the panel. So this is sort of, I hope, becomes a really good peer-to-peer discussion. But I think that at least, you know, having been in policing for 23 years, certainly coming up as a rookie, actually patrolling Oscar's neighborhood when I was a young man, the idea that policing could have an effect on health was sort of a foreign concept to the police. And there were people studying the negative effects of policing, but we're finally coming around to the thought that if policing is going to fulfill the role we need it to fulfill in our communities, it has to be conscious of its health effects and also be instrumental to better health outcomes, not just, you know, minimizing the poor ones. And so I think for me, I think that makes the unanswered question not what effects does the law have on policing, but what effects does the police discretion and interpretation of the law have in terms of health on policing? And so, you know, one of the things we see is so much of the law number one, signals to the police and the public what we're interested in, right? So laws about drug use, laws about violence, roadway safety signal that this is what the government cares about. We're empowering the police, whether people like it or not, to get involved in those things, detain people, do an investigation, render an outcome. And then we found, hey, the outcomes that they've been rendering are just like not up to par. It's incarceration, it's punishment, and it still leaves people vulnerable and still in need of some sort of risk behavior intervention. And then once we become conscious of that, I think what I've seen by way of stage setting is so much of the law that affects health is underdetermined or discretionary, whether it's how we enforce drugs, how we enforce roadway safety, whether we make an arrest for a low-level offense or not, whether we make an arrest for a theft or a burglary that's driven by substance use, for example. All of that is something that the police have a tremendous amount of discretion. So I think what we have to come to from a research understanding is the extent to which we want to curtail that discretion and have it veer away from police-related outcomes, or the extent to which we want to harness that discretion and steer police interventions towards health improving outcomes. And I think that's sort of, it seems to me, I think Scott's been doing this long enough to say nothing is uncharted, but it seems a little bit like uncharted territory. I see it from the former practitioner's perspective.
We'll come back to that uncharted territory in a second, but I want to give Miriam a chance to toss her answer into the question from the prosecutorial point of view.
Scott, she's been having some connectivity issues, so I don't know if Miriam's going to be able to answer.
All right. In that case, let me go to this. I mean, I think in the long run of this conversation, and considering also who's on the call and may want to ask questions, we face this challenge in moving upstream in this area. You start with the stress that police experience or how they exercise their discretion, and you're right at the coalface. This is what's happening on the street. And then we think back to the longer term questions of the mission and why are police doing the things they're doing, and why do we have a drug policy that we have, which goes to sort of deeper drivers of police behavior. And then beyond that, we go all the way back to sort of the notion of social control and what police are doing, and the legacy of racism and white supremacy in the police enterprise. I'm sorry. Now, Miriam just sent a message to me, Bethany, and I'm not in a position to answer it. Let me see if, Miriam, can you please pass that on to Bethany?
Yes.
Okay. There we go. So sorry about that. So, but I definitely want to get to sort of the deeper questions, like how do we reconfigure the police and the public health enterprise? We'll take sort of defund the police seriously in a few minutes. But at the moment, there are all these immediate questions. I noticed that Leo Beletsky is on the call, and one of the first study he and I ever did together involved trying to understand how police in Rhode Island were understanding syringe deregulation. And he had some interesting findings on that front that told us how much discretion mattered, a thing we've always known in police. But like, where do we have any, are you guys thinking of or aware of sort of models for change, new approaches to police training, to thinking about the tasks that police ought to do as opposed to somebody else ought to do, the whole task shifting model in things like traffic safety and responding to mental health crises? And are there programs that we ought to be studying now that help us move towards that uncharted water?
Scott, if I might interject, if I look back into the 1980s when I worked in law enforcement also, for those that were involved in the HIV/AIDS era, perfect example in my opinion, because we were given, gloves, and that we still didn't know a lot. And those that worked in law enforcement, you didn't know a lot of HIV/AIDS. But when you were dealing with individuals that were infected or possibly infected, you had police officers trying to address that public health issue. And trying to find the best way to deal with that and deal with the individuals in terms of protecting their rights or civil liberties and civil rights. What we have found though, like right now working in the DMV area, the DC, Maryland, Virginia, with law enforcement, Baltimore, as well as other agencies around, we began looking at a series of different ways of focus on what we call the epidemiology of policing. And when you look at this and you look at it in the context of, I'm trying to look at myself so I can gesture with my hands, balance out healthy behavior of police officer and policing versus behavior that can actually tip a tipping point, if you will, on behavior and processes. We've come up ourselves in Baltimore, a number of my colleagues that are part of our epidemiological criminology origins and genesis team formed. We're looking at operations, I'm looking at legal. When COVID hit, we began taking our model and applying it. We've been working even with the Brazilian military police as well, and working in this DMV area. And we began looking at operations, legal, logistics, safety. We look at incident command systems. We look at incident management teams. All of this has converged like a tapestry, if you will, in order to try to get a better picture of this. Scott, I don't know if this makes sense and to our panelists, other ones, but we've had to take a comprehensive approach to begin really looking at it and nailing and mining down.
Well, Oscar, you have some thoughts about how NACCHO is approaching the policing problem with local health agencies?
Yeah, so I totally agree with the concept of how do you really embrace and what are some of those best practices. And I actually turned to more recently the role in kind of redesigning and taking a look at the engagement around policing and the opioid crisis, for example, as good examples of such. Of course, what I dropped into chat is kind of the 10 standards of care approach that was worked out with a comprehensive approach, to Tim's point, around both engaging the police industry, the public health industry, and the community industry, and the education, in a way to really address what are some standards of care with both the approach to addressing policing and its impact and implication, and how to realign that particular area in a way that can be successful for all, recognizing that there's, of course, going to be an area of time to ensure that we have a similar understanding as to what are the elements of concern with both how you approach a particular scenario, whether it be, am I walking into this room thinking that this is a criminal scenario, or is there a social behavioral and addiction scenario, and how, therefore, do we both provide the law enforcement community with the essential tools to be able to both ascertain and use their judgment in a way that fits those particular models, while at the same time ensuring that we are looking at the broader construct of community security, community health, and mental safety, recognizing that there's some elements that are not going to be under the, in the construct of what law enforcement may be able to do, and why we need sometimes this coordinated activity and approaches that helps us, help our communities in which we serve.
We have, for a long time, the idea of legal epidemiology, of epidemiological criminology, the sort of convergence of law enforcement and public health has been built around an idea that, hey, we've all faced the same problems out there. And we obviously want the same sort of outcomes, humans who are thriving. So there's that kind of commonality. But some of the comments you guys have already made today, go to some of the differences. And one that comes to mind is training and stress, and the exercise of discretion, and how police come into the community. Brandon, I know that we've talked in the past about the degree to which there may, I don't know if this is documented sufficiently, what kind of research there is, but the problem that police officers are trained to be stressed out, and trained to be to treat everybody they encounter on the street as someone who might shoot them. Have you got some thoughts about police training as a kind of health question that we should be looking into?
No, that's right. I think police training definitely is not fully responsive to the actual actuarial risks of policing. I think it's wrong to ignore those risks. They do exist, and there is virtue in training for even the most unlikely but high risk outcomes, like getting shot. That's actually quite small. And I think that as somebody who was immersed in police culture for over 2 decades, one of the biggest things I found as I got older was like lamenting the overemphasis on risk and the overemphasis on hypervigilance and preparedness that turned everything into a tactical encounter, that turned everything into a possible risk encounter for the officer. And so I think there needs to be a healthy appreciation of those risks, but I think to focus on them has pathologized the citizen police encounter in sort of a pretty unhelpful way. I had a big rift with the Vermont Police Academy when I found they had a training scenario where they were asked to encounter the brand new recruit, who'd only been a police officer for 3 weeks, was asked to encounter a drunken hitchhiker at the roadside. This is in the police academy. And the scenario was the officer always asked for ID. So the hitchhiker presented ID, and if the officer looked down at the ID, he was punched as hard as he could be punched in the head. And the lesson was never, ever, ever, ever look away from the suspect. And I thought that no wonder cops are constantly thinking people are going to hurt them. This is the thing they're taught from day one, right? And you know, we can go on a tangent for quite some time talking about this, but if we're going to retool policing towards public health, part of the training to do so will be recasting the police-citizen encounter to better align it with actual risk rather than like the cultural pathology of risk.
Well, Leo Beletsky, since you're on and you mentioned the SHIELD model, maybe you could unmute yourself and say a few words about where you think we stand in terms of, you know, so I suppose you could say intervention research on police training.
You're muted. If Leo can't get his sound going, I do all the SHIELD training for him. I can translate.
Yeah. Let's see what's going on. Doesn't seem. Okay. Oh, now you're unmuted. Okay. Well, he can act it out, and you can tell us. Brandon,
yeah, no. Without Leo can just give a thumbs up if I'm getting him right. But so Leo and Scott was alluding to this. Developed training as far flung as Tijuana, but also Missouri, Indiana, Massachusetts, Rhode Island. That hits on something universal in policing, which I just alluded to, which is a deep concern for occupational safety, a deep concern for occupational health in the tactical sense. And what SHIELD does is shows police that the best health outcomes, not confiscating syringes, leaving behind naloxone, referring people to treatment, closely align with better occupational health and safety outcomes from police. So it's not this model where harm reductionists come in and say, all you've ever done is hurt people. We're going to show you the light, which people very strongly believe is true. But it's going to say, listen, if you care about not getting stuck by needles, if you care about not getting burned out, if you care about reducing crime and not just putting people in a revolving door where they're getting out and committing the same crimes, your interest as a cop is in public health. Your interest is in referral to treatment, is in clean syringes, is in leave behind naloxone. And jurisdiction to jurisdiction, it proves a lot more effective to come at the approach that way than to just lecture cops and say you need to be a harm reductionist. Does that sound right, Leo? Yeah, thanks. And it's all Leo's idea, so.
Does research give us any insights, and maybe this is something that the EpiCrim experience informs of the potential and the approach to a more systematic change in how police are trained? Actually, it does seem that's a bit upstream from where we were going with, in our initial discussion of just trying to look at how they exercise their discretion.
No, actually, let's go downstream if you might, because we're working, for example, with CDC and the NIOSH, National Institute for Occupational Safety and Health, in this area of first responders. And we've created in the epidemiological criminology side kind of what the 4 different aspects of biopsychosocial environmental, because in the training curriculum that we've created, we literally look at the biology of the cop, the stress, the anxiety, all the biological factors from a public health point of view that affects everybody, cop or no matter whomever. Then we go into the psychological states that look at the legal issues, the collaborations between cops, their organizational challenges, as well as those on the street. And then we cover the legal aspects of that, the incidences that can affect them, the management side. Then we go to, and stress being a big factor. Then we go to the sociological side, which is the operations of the agency, the legal, the communication, how that's policies and procedures. And lastly, we go to the environmental, the logistics of it. We look at the human resources side, the physical cost. And that's kind of what we've advised also to the Brazilian military police, as well as those in the UK as well. So we're trying to take this EpiCrim model to kind of share how the biopsychosocial environmental, very systematic, very methodical approach on dealing with law enforcement, because as we all know here, it's not a one size fits all. I mean, that's kind of how we do it. I'll shut up there.
I'm sure if I can jump in here, Scott. It's important you say that, because It also speaks when you discussing the whole training element, the engagement, especially with multiple sectors. So on the public health side of the coin, one of the first things that we needed to do when discussing somewhat of even joint investigation protocol for bioterrorism or emerging infections was that there's language differences. So when public health looks at something as we're looking at a case of Ebola, the public safety side of, well, we're looking at this case doesn't necessarily, align. So it's important to understand that there are, shared approaches that are going to be important to have an understanding of each other's language, and therefore what are the extensions of that effort. So to the latter point, even as I think about some of the health effects with respect to the public health, the law enforcement workforce, these are not dissimilar scenarios that we are seeing in our public health workforce. And I think COVID, as with anything, has actually amplified that. Our members, or when I say members of local health departments, they have police powers, and they've been thrust into the scenario around isolation, quarantine, regulatory authority, pushing these efforts. And at times we're seeing this clashing between the police powers on one entity on the law enforcement side and the police powers on the public health side. And how do we work together in the way to ensure that there's shared language or shared understanding of each other's language, and even shared resources. So I'll be very quick in this regard. We're going through an intense study of the mental health impacts on COVID on the public health workforce. And what I say to you, it's probably not dissimilar to what you've seen in the public safety side of the coin and law enforcement. Individuals are concerned about both their mental stability and the stressors that are hitting them on a day-to-day basis. The ability to really resort to each other, meaning others who are in their similar landscape versus someone who's outside of the industry. And also, what are the resources that are available to help them get through this coping and mitigation process? And what are those mechanisms that both positive and negative that folks are availing themselves of? So in that sense, we can't be siloed, but there's a value, I think, of working together in a way to really address these particular issues, because they're indicators that totally impact how we do our work and how we are truly out there addressing community needs.
Well, that does raise... Oh, go ahead.
No, I'm sorry, Scott. I was just very briefly, I think Oscar said something really powerful about language. I've always felt, I actually have a research study coiled and ready to go if I can find some funding for it, but it's that the incommensurability and the friction between policing and public health comes from that they have very similar goals and ideas in many cases, but their vernaculars are different. And the police vernacular allows them to pursue their goals using arrest and incarceration and force. And then the public health vernacular allows them to pursue a different class of interventions. But if you talk to cops and you were to put a translator on them, they'd say, we're here to reduce community level morbidity and mortality of certain violence and related risk behaviors, right? There's a public health language for policing that the police haven't availed themselves of. But I think forcing the two to meet and talk in those terms will help police see a whole other range of options to address those concerns that they haven't had access to yet.
Well, from a research, infrastructure point of view, the easiest thing you could say maybe as well, maybe health agencies could help, local health agencies could help local police departments figure out what to measure and measure it so they could actually answer those common questions in common terms with reliable indicators. But the larger question is still, I'm still looking 10 or 15 years after Epi-Crim and 10 or 12 years into legal epidemiology. I don't see a groundswell of funding for young researchers like you, Brandon. I don't see, clear NIH-supported career paths going forward. I don't see, we talk about data infrastructure for all sorts of issues now after COVID, but, do we have, is anybody developing consistent approaches to data infrastructure to do that kind of measurement of the effects of what public health and police are doing at local levels? Are they supporting these research careers? And if not, what are some ways that we can continue to push that?
So I'm going to jump in on one side and let my colleagues on the other panel to also jump in on their level. So it's interesting you say that, because right now, and I say right now, now as well as in the last year, there's been a significant push around data modernization and having access to data. Now, just to be very clear, yes, I'm at NACHO. We represented 3,000 county city health departments. 16 of those years of my life, I actually spent as a local epidemiologist at a local county. So the perspective of what data do I have? And epidemiologists don't just want every bit of data, they want quality data, which to the same extent to our partners and our researchers to your question, you want to be able to have access to very complete or comprehensive data that allows you to make either good analysis and recommendations for decisions. So I don't want it to be perfect. I just need to make sure I have as comprehensive as possible that it can really help in my decision-making process. So data modernization is a thing that's happening in the public health world. We recognize that. I can tell you our health departments right now, we are probably keeping the facts industry in business because we still receive our data on a daily basis by fax. So the opportunity to really collect both the streams of information that is being rapidly available, to be able to digest that and use it in such a way that's what we say interoperable, meaning agencies can be able to utilize it, see the benefits, see the processes in order to really enrich, as I would say, the practice side of the coin. That's where I think we should also look at as opportunities for funding and support in future research. Go ahead, Timothy, I'm sorry.
No, please forgive me. And Scott, if I might, and Brandon, it's really important what you said also. Funding is, I literally make my living on funding and finding resources. But what we've been doing across NIH, DOJ, NSF, and others is really trying to get this common lexicon, this common terminology, this taxonomy, if you will, of terminology. Because in public health and criminal justice, got degrees in them, so I'm saying public, we use the same terms sometimes, primary, secondary, tertiary, common used in criminal justice 101, same thing public health does. But the problem is that there are sometimes this absolute, like was stated, disconnect. And getting funders out there, federal, state, local, philanthropic, recognizing that we've got to get out of these silos. And that's kind of what being able to get interdisciplinary. The old saying goes, if everybody looks like me, thinks like me, and is trained like me, then why do you need me? And so that's why getting criminologists, criminal justice, public health, law folks getting together on joint proposals it's in my humble opinion, is highest success rates.
Yeah, that's a little bit like herding cats, but it's exciting to hear people articulate that. You know, the Journal of Community Safety and Wellbeing has a journal issue that is part of this conference. I know Leo and I and our colleagues have an article that kind of, I feel like everybody read it and they're cribbing off of it, or maybe, you know, or vice versa. We just cribbed off of all you folks. But Leo and I talk, and I'll give Leo credit for articulating this just right. But one thing that would help is the right actual endpoints. I was explaining something to Leo 2 years ago, and he goes, you're talking about surrogate endpoints. And that's that, you know, policing talks about arrests, guns seized, kilos seized, even crime rates. And those endpoints can be pointed to for success. But what they're missing is the underlying effect on community health and resilience and the actual state of the community. And you could see the same thing in public health, right? You could talk about the number of vaccines that are out there, but unless you talk about who they go to and what effect they have on infection, you're not getting at the actual endpoint of a vaccine, right? And so part of if there's these silos, maybe the silos can meet, if city councils and mayors and funders get this right, they could force the conversation to hone in on the actual endpoints that matter and force both sides to articulate their metrics and their measures in terms of the actual endpoints we're looking for, so that I'll stick with my own profession, so that a chief of police can't just say, I made 70 arrests and I've seized 80 guns and 90 kilos, I'm successful. No, what are the endpoints they're really striving for, right?
Well, you know, I think both endpoints and starting points are important here. I'll be a little provocative, or if not depressive in this, but when I look at the field now, what we're seeing, the kind of research that we're seeing come in, you know, in the rushes, in the daily digests of newspapers, and what we see in the abstracts, still tends to kind of be like, I don't know, research on lead poisoning in homes. Like, it's the very end of the line. We are talking about proximate stuff. How do we get police to kill fewer people on the street? How do we get, you know, public health services to step in and deal with people with acute mental illness rather than asking the police to do it? It's all really right there on the street. And on the one hand, there's a lot of great stuff to learn about how to make a lot of those kinds of activities and processes better for all of us. And it's kind of annoying that it's left to individual researchers or individual departments of health or public health or policing to try something, and to individual researchers maybe to evaluate it, and then individual peer reviewers to review, and you get a paper out after a year or two and it tells you, well, what they did in Burlington this one time, that worked pretty well, or it didn't work. And that's 2 years lost in which that learning might have been spreading to other places, might have been consolidated. We don't have an experimentalist approach to identifying, say, the top 10 reforms that seem most necessary and plausible at the proximal level in the cities in America. And let's see if we can have a well-funded and organized process to test them and find out in 2 years whether that works or not. Instead, it's, drug courts, do they work? 10 years later. Diversion programs, which kind of diversion programs? Which one? Well, by the time we've learned if they work or not, we'll have missed a lot of years when they might have been diffused or changed or critiqued. But even if you do all that, so that's the first sort of level I'd like you guys to address. How do we do a better job just organizing experimentation and research on solutions, intervention in the city level at the proximate endpoints? But of course, the broader question constantly comes up again is sort of the Don Berwick question. Every system is perfectly designed to produce the outcomes it produces. So if we see the outcomes that are on our streets and we don't like it, what makes us think that tinkering with the police or public health departments at the end of the line, at the end of the process, is going to really change anything? It seems like these vulnerabilities, these lacks of resources, these are determined by upstream decisions that will just reconfigure their mechanism of effect if you blunt, if you stop one little stream down at the bottom. So then the broader question is, what are the questions we need to be asking about the system that should be illuminated by research? So I put it to you, what can we do to do better now? And what about looking upstream better in our research?
So I'll start by saying, and Couchers and Brandon joke, our comment that we're from Brooklyn, so we go straight to the chase, right? We have to start where we can, recognizing that there are larger issues that are going to need to be processed, analyzed, et cetera. And I think this is where somewhat the difference, and from my lens, is from those that are the practical or the practical side of the coin versus the theoretical. And what I mean by that is as follows. You are absolutely correct. If we wait until data is collected, data studies, retrospective, long-term, et cetera, we're going to miss the boat. But there's a side that we actually utilize in the practical sense of, at least on the public health lens, called implementation science, where you're looking at what is being done and in vivo, and you're able to almost, I would say, build it or construct it or evaluate it as you're flying it. Right. So in that regard, you're able to get a much more real-time assessment and review as to what interventions, activities, suggestions, or the research developed objectives are able to be influenced while you're looking at the full implementation of a strategy, which you're trying to have a much more immediate response or immediate effect on, while at the same token ensuring that it's meeting the rigor and the guidance that we have for applied research and science. So I would say that we don't wait until we have 5 years, 10 years, 6 years worth of data, but that we incorporate some of this implementation science approaches, which allows us to both, I want to say control, but address both what are the immediate needs that are reachable and analyzable versus things that we recognize that will be upstream that may need other particular strategies versus what we have in our graphs now.
If I might interject with what Oscar said also, in his background in epidemiology too, everything, I don't care what anybody says, everything begins and ends with a theory. I mean, from the time, I don't care what case, when you're investigating a case, as Brandon can attest to, you theorize, unless somebody says you're theorizing, and everything ends with another theory. And that's where I think coming together on where the theory and practice, you give me a bunch of practitioners, you're going to get practitioner thinking. Give me a bunch of theorists, you're going to get theorists. But blending this, what you've done, Scott, kind of pulling this together. But here's where I really believe also on the like you said, upstream, is if we as different disciplines. And you're right, Brand, it is herding cattle, no doubt. But you know, it's what the federal agencies and fundings are looking for now. You get a bunch of criminologists and apply, you might not get funded, but you get epidemiologists, criminologists, folks coming together. But if we start looking at, like in public health, they look at sentinel surveillance, and you collect sentinel surveillance across the different sites. If we were to brainstorm ideas and use and blend that with the law enforcement side and figure out some ways, new ways of looking, unit that the lexicon, the terminology, and begin creating this, we begin creating kind of a repository of new ideas, new theories, new thinking. And because like Einstein said, you know, how's that old quote that he indicates right there? Everything, if, what is it? It's, where is it at? It's, I got it, yeah, here it is. Problems cannot be solved at the same level of awareness that created them. And I suggest that we really do what we can to bring different disciplines together.
Well, I think that's the scientific vision, right? And both the systematic and the transdisciplinary character is possible. We could do a better job defining the questions and answering them quicker, but that requires a kind of infrastructure and support. I was thinking we might ask Oren Gur from the Philadelphia District Attorney's Office to unmute for a second and just chip in some of the thoughts that he's been sharing in the chat, or otherwise, since we haven't been able to get Miriam to be able to join us to talk about prosecution. Oren, do you mind stepping in and saying a little bit about some of your reactions to this discussion?
Sure. Appreciate it, Scott. Hi, everybody. And, I think this is a really worthwhile discussion, and just have been appreciating what people have been sharing. It kind of made me think about the question that I posed there, which has to do with, how do we capture more information about interactions, contacts with police that do not result in arrest, which isn't, again, to kind of undersell the harms that are created through this law enforcement approach by and large, but more about kind of understanding the potential benefits of the softer touch. Because if we're not measuring the softer touch and its potential benefits, then it becomes harder to kind of advocate for it. And I know there are like programs like this, which you all have probably been involved with, such as LEAD and things like that, that are trying to better understand what, that type of diversion approach can mean. But I'm just kind of curious, like, are there good examples of those types of soft touches, as I'm referring to it, where, you're not actually taking a formal approach, but you're still able to capture what the impact is of not taking that more law enforcement approach? Just kind of a question.
Yeah, that's a hard one to answer, because so much of what policing achieves when it achieves its goals are unobserved hypotheticals. Like, were it not for this foot post by the train station on payday, there would have been robberies of people's paychecks, right? Or were it not for the police taking XYZ action during a violent dispute in the community, there would have been more shootings. So I know you're talking about something else, but it brings me back to the point that, like, if policing intends to be a life-saving intervention, then the absence of crime and disorder is the evidence of success, but that's like notoriously difficult to measure. And then we start falling, because it's hypothetical, like it would have been worse, but then we start falling back on, well, look, the police supervisors say, go out and show me something. So they come back with tickets, and they come back with, kilos seized. And so, I mean, when you talk about lead and diversion and stuff like that, right, I think it's great to at least start measuring. If we're going to measure arrests and then find a problem with arrests, we owe it to the police to measure diversion and reward good outcomes. And there's evidence that shows, right, that police contact with success, if the police send somebody into treatment and then they recidivate less, like the cop, hey, that's great, that works. I think that's the virtuous cycle you're looking for. But I'll just slide out of this by saying, yeah, you ask a really difficult question, Oren, and it's one of the holy grails of police reform.
But I also, I think you point to something which we come to the last few minutes to think about upstream stuff a little bit. I mean, when we talk about theory, I'm trying to say to myself, theoretically, I don't fully understand why we're going to spend a lot of effort and time in diversion programs that are based on the idea that there are people who are only offending because they need certain kinds of health or social services, so they'll have to offend in order to get the service. to me, when I talk about, well, what does defunding the police mean? I mean, what it means to me in part is, well, let's fund the primary services that reach people soon enough and where they live, so that they don't have to be arrested to get those basic services.
So one of the things I did as a chief of police, I'm sorry,
Leo, were you stepping in here?
Now.
Yeah, it looks like my mic is working. Sorry, Brent, to cut you off. I think Scott, I think that question is really critical and in many ways is responsive to a lot of the discourse that's happening around the country around, what does it mean to defund the police? And I think that the answer to that is, if you apply the structural determinants lens, then the answer may not be to recalibrate the role of police. It may be to shrink the role of police. And I think that that's where, that's a very useful frame to apply to the discussion, taking out the emotion-filled discussion about defunding or abolition, and leaving that aside as a rhetorical kind of point, but thinking more about how do we task shift and outsource the kinds of things that police currently do that they have no business of doing. And in fact, as Brandon mentioned in our training, we really try to make the point that it's the occupational safety and wellness frame really helps to get cops on the street to understand why task shifting and outsourcing may be useful for them, for their own sort of occupational wellness.
You raise an interesting point, if I can, that also, I guess, starts to address the elephant in the room, right? Some of the elements around this, quote unquote, defund the police is really structured against how are we truly addressing another impact, or whether it's perception, reality, or whatever, or the fact of the matter around those engagements, and why there's the concern around violence and impacts on communities, and what are those policies that need to be shifted in order to be able to address a much more unilateral kind of a more community level engagement of police and the policing industry in comparison to others. I mean, we have the same scenarios that we have to face on the public health realm, where, for example, we engage with communities, especially from a local health perspective, irrespective of their legal standing, et cetera, but we're just trying to focus on the provision of health. And of course, there's the elements that comes into play where there is a law enforcement engagement and certain procedures or certain addresses, whether it's issues such as domestic violence. Of course, we've already discussed the issues around substance abuse and drugs, also intimate partner violence, as I mentioned, as well as refugee, immigrant, migrant health. These are all elements that I think and historically from a community lens, there are these hurdles and challenges that has to be engaged if we're truly going to impart what are those policy shifts and how do we reinterpret and find ways of being more impactful. So I just wanted to add that to that lens because just didn't want to skip it.
Well, that's important. And I want to now maybe take a jump upstream a bit because Miriam Krinsky is on the line now and able to talk from Fair and Just Prosecution. And so let's pose a sort of research question this way. It's certainly a widely held hypothesis that drug control law, there are many widely held hypotheses about drug control law, including that they are in a sense were deliberately designed as a racist project to allow exactly what they allow, which is the mass incarceration of Black people and to some degree poorer people. There are also one of the few hypotheses that doesn't seem to be widely accepted in this area is that they actually control access to drugs, legal or and there's certainly that consensus is breaking down. Now, nowhere has the idea been more advanced that we should maybe rethink the controlled substances law than at the level of local prosecution offices, where we've seen progressive prosecutors sweep into office in all sorts of places and generally trying to deal with this problem of over-arrest and therefore generally trying to deal with drug policing and drug prosecution. So Miriam, what can you tell us about what is being learned and what needs to be learned in the progressive prosecution line? Yeah,
thank you, Scott, and apologies for the the connection problems. Hopefully, give me a thumbs up if you all can hear me at least.
Yes.
Okay, good news. At least it's partially working. You know, I think we are seeing in prosecution some paradigm shifts and a move away from that autopilot in the past when I was a prosecutor in the 80s and 90s, that we can criminalize our way out of these issues, and really a greater embracing of the public health starting point, at least, you know, among communities who in increasing numbers are electing prosecutors that are willing to further that type of public health and you know, let's shrink the system both at the front door as well as throughout the trajectory of the individuals through the criminal legal system. But I want to maybe return to what is accompanying that paradigm shift, and it really touches on some of the comments that Terry made in the chat and some of the things that others have said, which is prosecutors in these offices are recognizing that how we define success is critical. It's not simply the ability to measure, but it's what we measure. And that starting point of what success really means needs to be completely reset, because in the past, it's been very much of a quantity-driven metric of success, both in policing and in prosecution. We've been measuring things like the number of arrests, the number of convictions, the number of guilty pleas, the length of sentences, and really all of those are driving toward a very different ending point. If that continues to be, you know, the metric and the series of metrics that we focus on, then we're never really going to achieve the different starting point for the criminal legal system, a different starting point for policing. And so we're starting to see some efforts to really try to grapple with how do we make our communities healthier, not simply safer, because we can over-police our way to safety alone, but how do we start to grapple with metrics that define success around healthier and more trusting communities? So can we measure things like cooperation with law enforcement or with prosecutors? Can we try to capture user sentiments and trust in the system? Can we look at ways that we're measuring not simply things like recidivism, but how are we measuring sort of producing those positives? And again, I think that Terry's comment focused on it. How are we measuring what we're trying to fortify, not simply what we're trying to prevent? And we are seeing offices, and Oren and Philadelphia are in that group, who are trying to reset those metrics to look at a whole different panoply of measures, and to use that to measure the performance of the office and also the performance of individuals within that office. So I think if we're really to think about together, both policing and prosecution turning a corner, we need to try to reset that notion of what are we striving toward and what is the success that we're aiming to measure.
Oh, thank you, Miriam. So we're heading into our last 5 minutes. I want to give our panelists a chance to say a few final words about this, but I've made a couple of notes here, and we certainly have recurring themes of trying to be explicit about the goals, where there seems to be a lot of commonality, but maybe not as much development of clarity as we'd like. Then the development of measurement tools and approaches, data systems, so we can actually measure those goals. And then perhaps a more systematic approach to developing and testing interventions, all of which still leaves me feeling like, well, that's okay for that part of our work that's trying to make the current system work better, but what kind of, where are the gaps in the research on the sort of, you might say, the population level impact of our current law enforcement and public health, corpus of law, controlled substances law, minimum wage, benefits law, all the things that are sort of shaping the environments where we live, opioid controls and opioid interventions to stop the opioid epidemic. So I'm going to now pass it to you guys to comment on any part of that you feel moved to do.
If I might, Scott, you had mentioned about measurement issues. University of Tennessee, back in May of 2019, their mathematics program, their NSF-funded NIM BIOS, They pulled together the ceasefire and the epidemiological criminology, and mathematicians looked at different ways of measuring it. And there's a whole, you can go on Google and find their whole write-ups and the summaries of it. But it's a really unique and fascinating way of how do we measure this? And if I get me just a bunch of one discipline folks, that's going to change the dynamics. But I think what we is to do something like this, pull together everyone and come up with a new way, and a new way of looking at measurement as it relates to, well, look at the drug courts out there right now. You look at the various types of courts that are existing. You look at some of the misdemeanor and felony courts and begin looking at how those differ amongst one another. And see, within the criminal justice system, we like to think one size fits all, but this interdisciplinary way of thinking is critical. Now I'll shut up there.
So I was going to try to answer your question in at least the components of how do you bridge the gaps, especially challenges, and what are some of the opportunities for action to that regard? And I look at it, if I can frame it under the context of the equity and social determinants. And basically, the way I say this is that when we talk about that, we're really seeking to strengthen our capacity to confront the root causes that we know of health inequity through principles of social justice in our everyday practice beyond mitigating the consequences. And what does that mean? Well, we think about, at least from my lens, public health officials regularly face these ethical challenges every day, balancing individual liberty with protecting health, managing conflicts of interest with, whether there is a governmental agency or another competing thoughts, using and managing data in ways that protects privacy, confidentiality, allocating safe resources, addressing and negotiating our political constructs and constraints, and also complying with ethical and legal regulations and applying those legal authorities in a way that are consistent and appropriate. All of that, I think, provides an opportunity for convergence, both in the lens of how we both administer the work that we do collectively and collaboratively, how we reassess and realign, our resources and our opportunities for action, both in the research as well as the implementation of the law enforcement side, and as well as how do we come together in a spirit of partnership to really address these needs, recognizing that it's not just one particular envelope or one particular silo. There are multiple, everything that we see in the community. You cannot separate the mental health from substance abuse. You cannot, separate the educational and social services, as much as we try to, but recognizing that kind of an all hands on deck approach may be a way that we can work collaboratively to come up with some successful outcomes.
And Brandon?
So two things. To answer a question in the chat, the New York City Police Department did a multi-year 20,000 officer study of associations of education and performance and found that a bachelor's degree was the best indicator of good job performance vis-a-vis associate's degree, not having a degree, and military service, outperformed military service. The only people that did better than a bachelor's degree were people who had a bachelor's and were officers in the military, which I think that's one and the same in a lot of ways. But they found fewer officers with a bachelor's degree were fired, fewer civilian complaints, fewer uses of force, better evaluations. The NYPD I saw the study with my own eyes. The NYPD never released it because they had a hard time recruiting African-Americans with a bachelor's degree, because if you fought that hard to get a bachelor's degree as an African-American in New York, you weren't necessarily going to join the police. So it never released that study, but that study's out there and it says a lot. The last thing I was going to say, just to answer that question very quickly, is mayors, city councilors, and town managers and city managers control police departments and the other agencies that are supposed to be collaborating with them. And I think ultimately we can't just rely on the police and researchers to bridge this gap, but we need good municipal government to do so. And it really struck me, the New York City Police Department's charter, in the city charter, it is chartered, it says its mission is to protect the public's health. And I read that and I did a double take because it's right there plain as day. But I feel like not only did the police department not read that, but I think the city council hasn't read it either. And so I'd love some referee or some cat herder who can, over the course of several budget cycles, bring the researchers in, bring the police in, bring public health and safety in, and merge it all, following the evidence.
Well, thank you, Brandon, and thank you, panel. Thank you, distinguished audience. Thanks for all those interesting points raised in the chats, and thanks for contributing to this 1 hour, where we talked about the huge question of how legal epi can serve law enforcement and public health. I think we can close with the recognition that legal epidemiology, like epidemiological criminology, is both a sort of field and an appeal or an advocacy tool. We ultimately can't do research with no tools, with no funding, with no cooperation, with no organization. Good research needs an infrastructure of data. It needs to be able to support careers and people to develop the expertise and interest and sophistication. And the best case we have is that it's clear we don't know nearly enough about what we're doing, let alone about possible futures that involve doing something different. So that will be our carry home. What can we be doing to support those possible futures as researchers? And I thank you all for participating. Several more of these panels with individual abstracts and papers this week. Plus, we have a bunch of sort of plenary and preliminary material on the website that you can enjoy at your leisure. And of course, the Law Enforcement and Public Health Conference starts at the end of this weekend. And there'll be a lot more on this topic with a lot more wonderful people, including many of the people who were in attendance as participants here. So thanks, everybody. And we'll see you again soon.